I'm Rochelle Chernowski. This is Shell Point Today for Tuesday, November 12th. On today's show, our Medicare Billing Department discusses how you can make changes during Medicare's open enrollment period. We'll also talk to Joseph Julmeus, whose travels to Haiti are the focus of a special Academy event coming tomorrow. But first, our Festival of Heroes week continues this afternoon. We know many of you are veterans and have stories from your time in the service, whether they were heroic times or just everyday duties. This afternoon, we continue our Salute to Heroes with a special Get to Know Your Neighbor event for all military veterans. Bring out your war stories, paraphernalia, uniforms, photos, and more, and get to know your fellow veterans at this grand event at 1:30 p.m. in the Grand Cypress Room at the Woodlands. And then tomorrow, we focus on heroes of a different kind. In January 2010, a massive earthquake struck the island nation of Haiti. Since then, a huge relief effort has been undertaken to rebuild the country and help its people. But for Shell Point's laundry supervisor, Joseph Julmeus, helping Haiti is nothing new. Joseph was born there and has traveled there his whole life to help his homeland. Tomorrow, Joseph will share some of his travels in photos and stories. It's Shell Point's Hero for Haiti, happening tomorrow at 10:15 a.m. in the Social Center on the island. Terry Colath has this preview.
Hello, everyone. I'm Terry Colath, and I'm here today with two important Shell Point employees, and we're talking about our next Coffee with a Neighbor in the Shell Point Academy. I'm going to be talking with Joseph Julmeus and Paul Yacovitch, and we're talking about Hero for Haiti. Joseph and Paul, we're looking at this week of celebrating heroes at Shell Point and wondering what the Academy could focus on. Jared Pike and I were discussing this, and he said, what about one of our own heroes? We have Joseph, and everybody loves the idea. Joseph, a hero for Haiti. What's it like to work with this hero, Paul?
Well, I've been very fortunate. Joseph has been here for over 20 years. We just recognized his 20-year milestone. I've had the fortunate opportunity to work with Joseph since I've been here, which is nearly 15 years. His involvement in not only in the Shell Point community, but the community without Shell Point is just tremendous. So the moniker hero is well suited. He's very active in the local community, Haitian community, in the church. He travels annually to Haiti to help with a medical team out of Miami. He's continually sending all kinds of clothing and other items over to help the Haitian community. And a few years back, when Haiti experienced that tremendously devastating earthquake, Joseph was there. And we were really worried about this guy.
At the time of the earthquake?
Yeah, we didn't hear anything about him or from him for days. And he finally had to work his way through the Dominican Republic to find his way back to the United States. So again, in every aspect within the local community, helping with the local employees, be it translation or just bringing issues to our attention that when Haitian staff needs help, to the local community within Fort Myers, to his many, many trips to Haiti.
It's fabulous. So you have a lot of support from your department.
Thank you.
Shell Point, right? From the people you work with here at Shell Point. Yes, a lot of support. Because a lot of people are very impressed by what you do for other people. Joseph, how long have you been in America? When did you come?
I come in 1980. And I was in Boston for 10 years, and I moved back to Florida in 1980, and I started to work with Shell Point in 1990.
Well, Joseph, you've shared with me the projects you've worked on, and we're going to be so glad to share them with our residents in this Coffee with a Neighbor. First, your food distribution project, taking food to Haiti.
Oh, I wasn't trying to start to help Haiti. 1995, my first trip, and I go to put rice in the bag, put the beans, put everything, and drive the truck all the city and south and north to make a delivery, because at this time some hurricane season happened in Haiti. A lot of people out of drink, out of food. And after that, back to the United States, and again I make another trip to go to a medical team to help people all the country to give a medical, take the doctor with me, help him to translate it. That's what I do. And
so you help the doctor, you translated, so the doctor that you took with you could actually hear what the people were saying and understand what they needed.
What the medicine you need, what kind of sickness you got it, to help them to explain and to try to give you treatment for it.
Gee. And then school construction.
I start to do the project for the school because I did the school from the dirt to put it the new building you see over there. It was a little building. And the people don't have any bench to sit down. Sometimes people stand up for 8 hours a day. And when I start to build the school, and we try to make it a school like that, and people got the almost a lot of benches got now, and the school coming very nicely.
And then just last month, you went back for a water project.
For water project. Now you got a clean water. Even the community can't use the water, and school also got a clean water to drink.
And you took a few things from Shell Point with you.
Oh, yes, I got a lot of television. A lot of people never see television almost their life. We're excited.
This would be a great opportunity to thank all the residents here because as I was explaining to you, Terry, when we converted to all digital television, the signal, a lot of the existing TVs, the analog TVs, no longer would receive the signals. And we asked the residents that if we could pick up those TVs and donate them to Joseph. And Joseph has collected hundreds of televisions that will work in Haiti. So those people that don't have television in Haiti, good or bad, depends on how you feel about television, they've been bringing them over there. So it's a tremendous effort.
It must be amazing, especially for children to see. Yes. Fabulous. Well, Joseph, I would just like to encourage our residents to take a look at the current November Shell Point Life and see a picture of you and Harold Hansen, who you've partnered with, and see some of the photographs. And then I would like to share with you that we have other photographs we're going to look at when you come for a coffee with a neighbor. And we're going to have Joseph explain to us what we're looking at. So we are just delighted to have this celebration in the week of Celebrations of Heroes with our own hero for Haiti, Joseph. Won't you join us tomorrow?
Now on to more of today's news. If you struggle with vision issues, we have people here at Shell Point who can help. Caitlin Kramer-Smith has been a guest on this show, and she's coming this morning to discuss practical tips on living with low vision. It's part of the Vision Enrichment Group, who have their first meeting at 10:15 a.m. in the Social Center. All are welcome to this informative event. If you have any questions about the Vision Enrichment Group, call Angie Pritchard at 454-2134 or Sandy Weber at 225-2929. We also have this note about Medicare. Last month we focused on Medicare Part D, which is the prescription drug plan. Now we have information about regular Medicare, why you may need it, and if you need to make changes. Our Medicare billing department recently held a presentation about the open enrollment period, the time of year when you can make changes, which runs from now to December 7th. Here are some of the highlights of that presentation.
Okay, we'll start today with Open Enrollment 2014, and we all know that Open Enrollment is now until December 7th. So you have to make a decision by then what you're going to do with your Medicare benefits. The very, very important is to keep your book. If it's the Medicare book or anything else an insurance company will send you, please keep the book. It is very, very crucial because this will outline exactly what your benefits are going to be throughout the year. So it doesn't matter which plan you choose, doesn't matter which insurance you'll have. And if you need to understand what is in that book, if you need to sort things out, please come and see us. We're happy to make appointments with you and sit with you one-on-one and explain it. What is Medicare? Everybody probably knows this. When you turn 65, you're eligible to receive your Medicare benefits. And we usually refer to that as the traditional Medicare plan. And it will cover a large portion of your medical benefits and your medical care. I'm going to have Diane come up and talk to you a little bit about the Part A plan and what your benefits are and how you get that.
Part A is your benefit at no cost after paid in or worked 40 quarters or 10 years in your working life. Part A is defined as coverage for inpatient services. It covers your hospital stays, and it would cover your skilled nursing a stay in our skilled nursing facility. Part B, the coverage that you get when you sign up for Medicare, is not free. The premium is based, it used to be a flat fee until last year when they decided to increase it, and it's based on your adjusted gross income for the previous 2 years. The Part B benefit covers your outpatient services like doctors, labs, medical expenses, and most testing. In the Medicare book, it refers to Part C. There's A, B, C, and a lot of things I know, but the Medicare Advantage is referred to as the Part C program. And it's offered through many companies: Aetna, Blue Cross and Blue Shield, United Healthcare, and Humana. They all have Medicare Advantage plans that anybody can go and call their insurance agent and ask them that they want to sign up for a Medicare Advantage or replacement policy. And a licensed insurance broker can get you a plan from any of those companies. You can purchase that plan. Traditional Medicare Part A usually has a deductible for inpatient services. And traditional Medicare Part B pays 80% of most of your outpatient services after the deductible, unless it's a wellness service, in which case it'll pay 100%. Supplemental insurance plans C through N, those are the plans that you can buy that cover skilled nursing facility coinsurance. Plans A and B do not, but plans C through N do, which if you want to have skilled nursing facility coinsurance paid for, those plans would be the ones for supplements. And they pay your deductibles, and they may pay your deductibles depending on the plan that you choose and the remaining balance of all Medicare-approved charges. Not all supplemental insurance plans are the same. There are many to choose from, and it's the same stands with the supplemental plans that you receive from your retirement plan. Those can be different from the uniform supplemental plans that you can buy. And to be worry-free at ShellPoint, a Plan F is recommended, and that plan would cover everything that you would need to pay for here at ShellPoint. If you could choose a Part C plan, which would take the place of traditional Medicare and enroll you in a private insurance company, there are only 4 in this area to choose from, and those would be United Healthcare, Blue Cross and Blue Shield, Aetna, and Humana. However, in ShellPoint, as mentioned before, with both Aetna and United Healthcare, you will need to use your out-of-network benefits.
Some of the pros and cons about the Advantage plans. Here we have the pros listed. In most cases, not all cases, but in most cases, you will have no monthly premium. And in some cases, again, not all cases, the drug plan is included. The cons for the Advantage plans are you have some deductibles in many cases and copays. Most everybody will have copays that will apply when you go see your primary care physician. And they're higher when you see your specialist. If you are on traditional Medicare, you will not have those copays. And if you have a good supplement plan, that will pick up to 20%. An example of traditional Medicare versus a Medicare Advantage plan, following a 3-day hospital stay, a resident is admitted to the pavilion, and the 3-day hospital stay is a qualifying factor. You have to be inpatient for 3 days before the pavilion stay would be paid for. Under traditional Medicare, you may pay for days 1 through 20, nothing. And then days 21 through 25, your out-of-pocket cost will only be $740. With an Advantage plan, we used United Healthcare as an example. You will pay for days 1 through 20, $3,800, and you will pay for days 21 through 25 or 6, is that? Oh, thank you. You'll pay $4,875. So there's a huge difference in your out-of-pocket expense if you end up having to use the pavilion services. The pavilion or skilled nursing facility is out-of-network for all insurance companies. Every traditional commercial insurance company is out-of-network. So you again refer to your insurance handbook. It's really important that you have it and keep it. Don't throw it away. And that goes for the skilled nursing coverage and the outpatient therapy, should you need that. A hospice. If anyone needs hospice services, any traditional Medicare will take over. So if you have an Advantage plan and you are enrolled in hospice, that drops right then and there and Medicare takes over. At that point, you have no supplement. So Medicare will pay their 80% and you will be responsible for the 20%. If you have traditional Medicare and a supplement, this will not be a concern for you. And then we have the Department of Veterans Affairs and the Department of Defense. If you have served in your lifetime, if you have been in the military during war, if you've been deployed, all of those are qualifying factors that could get you TRICARE for life. So you might want to make a couple of phone calls or go on the tricare.mil/mybenefit, and you can find out whether or not you qualify to receive TRICARE for life. And that is a supplemental insurance after Medicare that will cost you nothing and cover absolutely everything. Save all of your explanation of benefits. We call them EOBs. Medicare sends them out per quarter, and it shows all of the different things that Medicare has paid for, has been billed for. If you have any questions about any of the services and you're not sure if you've had it or if you have a question about it and why am I being billed this and is this a right charge, please come and see us. Bring it over, come and see us, and we'll help you sort it out. If you get a bill that doesn't make any sense, come ask us. Give us a call, come ask us, and we'll be happy to do whatever's necessary to sort out that situation for you.
You can watch this 60-minute seminar in its entirety. Just visit www.shellpoint.net/SPTV. We have both this seminar in its entirety and the Medicare Part D seminar, presented by Joy Darnell of the Shellpoint Pharmacy. Yes, Medicare can be pretty confusing. That's why we have an entire department that can help you with it. If you have any questions about Medicare, call our Medicare Billing Department at 454-2202. Now it's time to cover all of today's happenings from Resort Services. Then stay tuned for your Academy News, menus, and Village Church connections.
Happy Tuesday, everyone. Thank you for joining us today. We're here with the happening segments. My name is Leslie Brandt, and this is Bev Chanley. And we are here to tell you all about the activities for this wonderful Tuesday. At 7:15 is the Health Connections, the Bend, Breathe, and Balance, and the Health Club. 8 o'clock, we have round robin men's doubles tennis in the tennis courts. 8:15, we have the Stamp Ministry, and the volunteers are welcome in the stamp room. 8:30, we have bocce, the bocce courts. 8:30 also is the Ladies Golf Association with the Shell Point Golf Club. 9 o'clock is the Susie Q, the Dolphin and Sightseeing Tour. Sign up is required. 9:15 is the open painting in the art studio on the island. 9:30 is the match play mixed doubles tennis at the tennis courts. 10:15 through the Bible study group in the Osprey Room. Also at 10:15 is the Vision Enrichment Group at the Social Center on the island. 11 o'clock, take the Susie Q to Rum Runners for lunch. Sign up is required. 11:45 is the Health Connection, living healthy in the Osprey Room on the island. Now here's Beth to tell you about the afternoon activities for today.
Thanks, Leslie. We're going to start out at 12:30. You'll find mixed progressive bridge in the game room down at the Woodlands. 1:15, you'll find the Knitters group in the Osprey Room. Also at 1:15, we have shuffleboard being played on the shuffleboard courts on the island. And then we have 1:15 rollicking recorderists in the Tarpon Room. Another 1:15 activity is the Women's Ministries Prayer Group. They'll be in the hospitality room at the church. At 1:30, we have Do You Know Your Neighbor? This time it's for veterans. They'll be in the Grand Cypress Room down at the Woodlands. At 1:30, the Stamp Ministry will be busy in the Sable Room at the Woodlands. And at 2:45, we have Balance and Mobility Training Level 2 in the Health Club, and that's currently full. At 3:30, we have another Health Connections class, Shell Point Pole Walking class. That'll be in the Oak Room of the Woodlands, and that is full. Thank you so much for joining us, and we'll see you right back here tomorrow.
Hello, I'm Terry Kolath with your Academy information for Tuesday. At 9:15, Skype Basics begins in the Computer Teaching Center on the island, and sign-up is required. At 9:30, Advanced Memoirs on the Computer continues in the Computer Center at the Woodlands. At 10 o'clock, Islam, Its Origins, Growth, and Future, class number 2, will take place in the Grand Cypress Room of the Woodlands, and you can sign up right at the door. At 10:15, Apple iPad Tips and Techniques continues in the Manatee Room on the island. And at 1:15, our how-to class, using a word processor, continues at the Computer Teaching Center on the island. At 1:15, storytelling continues in the Manatee Room of the island. I'd like to tell you about a new class coming tomorrow. It's Coffee with a Neighbor, number 3, Coffee with a Shell Point Hero for Haiti.
Menus for Tuesday. In the Crystal Room, the Crystal Platter is turkey pot pie with buttermilk biscuits. For dinner, it's the Pan Fresh Night for $11.95, and the soup of the day is cream of chicken. In the Island Cafe for lunch on Tuesday, enjoy an Alpine chicken sandwich with a side salad for $7.25. For dinner, it's meatloaf with mashed potatoes and baby carrots for $8.25. Dinner specials in the Palm Grill on Tuesday are shrimp scampi for $13.95 or pork tenderloin for $15.95. All menus are available 24 hours a day at www.shellpoint.net.
Hi, welcome to Village Church Connections. I'm Andy Hawkins, the senior pastor of the Village Church, and I'm here to introduce to you a special emphasis that we're having not only at the Village Church, but in fact in the entire Shell Point community. Next week is Heroes Week here at the Shell Point Retirement Community, and as a relative newcomer to Shell Point, I love that theme and that emphasis. We all have heroes. People who have been important to us. They have contributed to our well-being in a variety of ways, materially, emotionally, and even spiritually. And they've often done that in quiet ways, behind the scenes, content to serve in the background. But when we take the time to think about them, we realize what life would be like without them, how our circumstances and sense of well-being would not be anything like it currently is. Recently in the Village Church, we talked about one of Paul's heroes. That's right, Paul, the great hero of the church. He had a hero, I think, and his name was Tychicus. He's mentioned in the closing verses of Ephesians as a beloved brother and faithful minister. And when we walk through the New Testament looking for references to Tychicus, he shows up with some frequency. He's with Paul in the beginning of one of his early missionary journeys, and he stays with Paul through thick and thin over a course of more than a decade or two. He stays with him when life is good, and he stays with him when Paul is in trouble. Paul wrote several of his epistles from prison, including Ephesians, and Tychicus is right there with him. The interesting thing is that there are no recorded words of Tychicus in all of Scripture. He was a quiet hero. And it's not that he never spoke. From time to time, he was called upon to be a messenger for Paul, and I'm sure he spoke on those occasions. But no recorded words are left for us to reflect on. But that's the way it is with many of our heroes. They're quiet, in the background, but contributing significantly to our welfare. You know, one of my heroes from my church in Morgantown, West Virginia, is like that. This woman was well acquainted with suffering. She walked through lengthy illnesses with several family members, faithfully ministering to them, including cancer with her daughter and her husband on 2 almost consecutive periods of time. And yet she clearly trusted in the Lord through it all, and was quick to be an encourager to others, even though she was going through difficult times herself. Her desire was to glorify God, whether times were good or times were tough. And because that was her attitude, she lifted up all who crossed her path. And I marvel at how she walked through those times, and that's why she is one of my heroes. She was like that because of her hero, a hero that I share, in fact, a hero that all Christians share. Our ultimate hero was Jesus Christ. He was the man of sorrows, acquainted with grief, who for the joy set before him endured the cross, despising its shame, and in doing so led many sons to glory. He is a hero who did something for us that we could never do for ourselves. He's called in the book of Hebrews the author and perfecter of our faith. And the word author in the Greek is archegos. It's variously translated in various aspects, portions of ancient literature as founder or leader or champion. And yes, it's even translated as hero. I trust that you'll be quick to think of your heroes and honor them during Heroes Week here at Shell Point. A good opportunity to do that is at our Shell Point Community Heroes Service. It will be held here at the Village Church on Wednesday at 7:15 on November 13 during the middle of Heroes Week. And there will be a special opportunity for you to remember those who have been important to you, those who have contributed significantly to your well-being. And we hope to see you there. Whether you are not a regular attender of the Village Church, we hope that you'll come to that Shell Point Community Heroes Service on Wednesday, November 13 at 7:15 p.m. in the Village Church auditorium. Thanks for joining us on Village Church Connections, and we hope to see you there.
We're glad you joined us for today's show. Tune in tomorrow as we preview the next big event in our Festival of Heroes, a concert from world-renowned tenor and former New York City policeman Daniel Rodriguez. Until then, this is Shell Point Today for Tuesday, November 12th. I'm Rochelle Chernowski. From all of us here at Shell Point TV, we hope you have a great day, and we'll see you again tomorrow.